This is the PowerPoint for outcome measure tools for special topics. So what is an outcome? Outcomes, by and large, remain the ultimate validation of the effectiveness and quality of medical care. So these are extremely important to use as PTAs, and in this lecture we're going to talk about what outcome tools are, why we use them, and we're going to talk about the different types of outcome measures. So what are outcome tools? They are a standardized instrument for measuring patients' activity limitations and participation restrictions. These also will help us assess the effectiveness of our interventions that we come up with as PTAs. We can also use outcome measures to establish a baseline for how a patient is starting. And these will also help with reimbursement. The reason we often need these for reimbursement purposes is that insurance companies often want to see that we're making progress and improvement with our patients. We need to basically establish the need for physical therapy for these patients. So why do we use outcome measure tools? First and foremost, they often help us guide our practice because they give us information on how a patient is doing that allows us to set goals. It will often answer patient and family questions regarding an individual's condition. It will help us communicate with physicians and other medical professionals, other PTs and PTAs. It will help us communicate with policymakers that are involved in outcomes in the health field. It improves our self-efficacy as a profession, and it also documents our efficacy. So if we remember, efficacy is the ability to produce a desired or intended result. So essentially when we use these outcome measures, we're assessing our patients making the improvements that we're looking for. Effectiveness is the degree to which something is improving towards that desired result. So oftentimes efficacy and effectiveness are sometimes used interchangeably. Now there's several different types of outcome measures. The first one we're going to talk about is patient-reported outcomes. So this is a self-reported measure that a patient fills out. It's usually a questionnaire, and it's used to assess the process of rehab. And since it's based on the patient's perspective, it can often be a little biased, but it does give you the patient's view of how they are doing. An example of this would be the Oswestry Low Back Pain Questionnaire, which is posted on Blackboard for you to take a look at. Performance-based outcome measures. These provide objective assessments of functional capacity that allow us to assess our rehab intervention and how it is helping our patients. It is less subjective compared to our patient-reported outcome measures. There's not as much patient bias included in those and not as much of a placebo effect. So an example of a performance-based measure might be the Berg Balance Test or the TUG. These were things that you learned with Ginny in Rehab 2. So overall, performance-based measures are more outcome-based and more objective measures of a specific task. We also have instrumented outcome measures, and these provide a direct measure of an individual's actual involvement in activities that require a certain amount of mobility. Through these instrumented outcome measures, we can use different types of technology. We can use cameras, pressure sensors to collect data. This data that is collected using these instrumented tools is very unique. However, it often is very difficult to use in a clinical setting. It often requires very expensive equipment. However, if you do have this as a resource, you can include it to assess individuals' performance with activities of daily living during certain functional tasks that they will do. So examples of this would be a motion analysis lab or an accelerometer, and even a Fitbit is an example of an instrumented outcome measure. So how do we decide which outcome measurement tool to use? How do we decide what's the purpose of this outcome measurement tool? the thing to keep in mind is that these measures take time to complete. So you basically want to pick the most effective measurement system that will give you the most information. So things to consider when choosing your outcome measurement tool. So why am I using this tool? Are you using this tool to identify the impact that you might have on an individual patient? Are you trying to establish a baseline? Are you evaluating the effect of your treatment? Or are you evaluating whether this patient needs more services, they need more PT sessions? And that's something that insurance may want to see. So what am I trying to measure with these outcome measurement tools? Oftentimes we're looking at impairments in body structure and function. We're often looking for activity limitations, participation restrictions, and quality of life. And if you remember, each of these components is part of the ICF model. Another thing to consider is the clinometric properties of the tool, and have they been assessed and measured in the patient population that I'm going to be using it in. Now, clinometric properties, this is basically the quantitative evaluation of the tool that you're using. So essentially, has the measurement tool been assessed to determine that it's an effective measure, but within the correct patient population that you're using? So you want to know, in the research studies, did they have a similar sample size, or did they have patients that had the same condition, the same severity of the disease? Did they have similar characteristics to the patient that I want to use my outcome measurement tool? Because the more similar the study population is to your patient population that you want to use the measure with, the more likely you're going to get similar outcomes to what was seen in the research study. Looking at reliability and validity of our measures. So reliability refers to the degree to which a test is consistent and stable in measuring what it's intended to measure. So essentially, it's testing if a measure is consistent with itself and consistent over time. So think of reliability as consistency. So when you test something 3 times, you get 3 very similar outcomes. Now, validity refers to the degree to which the test actually measures what it says it's going to measure. Okay? So to kind of compare these, looking at these 3 different bullseyes, so starting with our left here, we see all of the bullseyes are in the same area, so they're very consistent, which would mean that they're very reliable, but the point of the bullseye is to hit the middle. So it's not really a valid representation. So it's not measuring what we're actually trying to measure. If we look at our middle 2 bullseyes, you can see that they're not very valid because they're not consistent with the location, and they're not very reliable either because they're not aiming at the target. Now the last bullseye on the right, again, we see consistency, so our good reliability, and validity because it's the target is hitting the middle of the bullseye. So how do I know if my outcome measure is reliable? So there's several different components that can be looked at with our outcome measures. So knowing what the minimal clinically important difference is, or the MCID, knowing the minimal detectable change, or the MDC, so these values will tell you if the smallest amount of change that needs to occur in a measure for it to be meaningful for our patient and for it to be accurate, essentially, telling us that this patient made a significant change and it's meaningful to this individual. This will also tell you if a certain population is more appropriate for certain outcome measures. Okay? And looking at the rate of error of the measure as well will often give you good information as to how reliable it is. You can also look at things like standard deviations within research studies, standard error of the mean. This will provide you with more information about the reliability. If we want to look to see how valid a measure is, essentially we need to see, is the tool measuring what we're asking it to measure? I think a great example is the tug. So the timed up and go, you have a patient stand up from the chair, walk a certain distance, turn around, and sit back down. Now, balance is something that you need to have in order to do the tug task. However, the tug is not a measure of balance. If you wanted to really assess someone's balance, you would use a Berg balance scale. So the tug is not really a valid measure to evaluate balance. Okay. Other things to consider when choosing an outcome measure, financial considerations is also important. So some tests you have to pay for or you need to pay to use. You also should consider how much time it takes to complete one of these outcome measures. If it takes 20 to 30 minutes and you only have 45 minutes with your patient, maybe that's not the most effective or beneficial time to spend with your patient. Oftentimes you might need to be certified or licensed to administer the outcome measure, and is there any equipment that's needed? Oftentimes you need to pay for special equipment to use with this outcome tool. Therapist implementation of our outcome measures. So is it easy for the clinician to complete the outcome measure? So if it's a simple test like the tug, all you need is a chair and a stopwatch. So it's very easy to use the tug test. Again, is there any special training that's required? Do you need to go to any courses? Oftentimes, if the directions are not very clear or they're not standardized, that can make it more challenging to complete the outcome measure. Again, how much time does it take and how long does it take to record the results? Oftentimes you spend another 5 to 10 minutes tallying up the score and figuring out what the results even mean for your patient. Along those same lines with our outcome measures, resources is often important. So is there any special equipment? Is there anything that you need to have in order to complete the task? Do you have enough room to complete the task? Okay, we mentioned the tug. It doesn't take a lot of equipment or a lot of time to do. The stair climbing test is often an easy test to administer. All you really need is a flight of stairs. So it depends on what the outcome measures are.